Neck. What treatment is possible? My neck started to drop when I was only 37. I've had Ultherapy and Botox, and no major improvement to the key problem area, which is apparent in the photo. I am going to go back to the doctor, but wanted to know if there is any treatment that can actually help with this problem.
Thank you for your question. You submitted your question with 2 photos, and you state that you had sagging of your neck that began at age 37. And you show in the photo this area where there appears to be what looks like a platysmal band. And you state that you've already had Ultherapy as well as Botox, and neither have worked. And you're looking for additional guidance as to what you can do. Well, I can certainly share with you a little bit of understanding of the challenges of this type of situation, as well as in the context of your age. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Helping people rejuvenate their neck has been a big part of my practice, basically in line with a core focus on facial aging. And certainly the approaches that you've tried reflect what is, I think, reasonable from your perspective as being relatively young and somebody who wants to avoid a surgical procedure naturally. Now, I could certainly say that it has been my general impression that when it comes to a issue which seems to be dominated by the muscle that is called the platysmal muscle, and that what you have is a prominent platysmal band. Now, that being said, it would be, in my opinion, less likely that any kind of skin shrinking strategy, whether it be any radiofrequency device or anything else, will have limited value if that band of muscle is still significantly affected. It is somewhat surprising that Botox did not work as well as you had hoped, but it might be worthwhile for you to try Botox again, maybe to see if the dosing may be adjusted to relax that muscle further. That being said, my approach in your situation, again, this is in the absence of a physical examination, but my next level of approach would be to consider a procedure such as a suture suspension surgery. Now, this is a less invasive procedure than a face and neck lift, and it is not a thread lift. A thread lift is basically trying to take the skin and shorten it in a way where it is skin to skin. A suture suspension procedure actually is doing everything except removing skin, like a typical surgery where you do remove skin. And that involves placement of a non-absorbable suture in a way that can try to engage the muscle and bring it up. Now, a lot of times I will combine that with Botox as a appropriate next in line therapy. Ultimately, if something like that would not be appealing to you, or you want to do something more aggressive, then some type of neck lifting procedure would be necessary. What that entails, it depends on the individual surgeon. A lot of surgeons, myself included, would consider basically going from underneath the chin and seeing if the muscle called the platysmal muscle can be reopposed and sutured together. It's called a plastymaplasty. There's also variations of different types of platysmal band releases where a wedge of that muscle is actually removed, and further from behind the ear the muscle is engaged and pulled upward. Now, I have to make that kind of description with a certain caution. There is a relatively high recurrence of platysmal bands, And a lot of our colleagues don't want to acknowledge that, but it is a reality, and even the most experienced senior teaching surgeons will honestly acknowledge that recurrence is possible. So you have to think about that as a reality even with surgery, and certainly that can be something that has to be factored in before you make that decision. So I think it is worthwhile, again, to consider additional Botox and maybe a combination of a Botox with suture suspension as a possible strategy, which is a less invasive approach. Further face and neck lifting, or neck lifting specifically, may be an option, but again, you have to decide, does it bother you enough to go to that level of procedure? The youngest patient I ever did a facelift for was 37 years old. So, but I always explain to my patients that there has to be a real risk-benefit ratio that's favorable. You know, a lot of times when people are bothered by their neck, I also say to them that really most people don't, in social interaction, look at the neck directly. They look at your eyes. And this might be some way to actually refocus your perceptions, because it's very common for patients to look at themselves and hate a particular thing, and that thing becomes amplified and magnified, when in reality most people don't even notice it. So that could also be something that you factor in before you move forward with any type of more aggressive procedure. So I hope that was helpful. I wish you the best of luck. Thank you for your question.